Is your cold making it hard for you to get to sleep and leading to a bad morning? Switch to Mucinex Night Shift for fast, powerful nighttime multi-symptom cold and flu relief. Mucinex Night Shift fights your worst nighttime symptoms to help you get to sleep and wake up ready to go. Mucinex Night Shift. It's comeback season. Use as directed.
Welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm your host and public health scientist, Dr. Jess Dyer, and today we're going to talk about murmurs. Now, the clock is ticking, so let's get to it. So I was actually just going to launch into my personal anecdote. So I've been diagnosed with a murmur, and both of my kids were diagnosed with murmurs when they were first born. So what exactly is a heart murmur? A heart murmur is an extra or unusual sound heard during a heartbeat. So specifically, it's typically described as a whooshing, humming, or rasping noise. These sounds occur when blood flow within the heart is turbulent. Murmurs are detected using a stethoscope during routine checkups, and they can be innocent or they may indicate an underlying heart condition. Now, it's important to understand, this is very important, that a murmur is a sound. It is not a disease in itself. So how common are innocent heart murmurs in kids? Well, the answer is they are quite common. Up to 75% of children may have a detectable murmur at some point during their childhood. The vast majority, over 90% of these murmurs, are innocent or functional. They're most common in newborns, as well as kids aged 3 to 7 years. And many children will outgrow these murmurs as they reach adolescence. Now, these statistics highlight that in most cases, a heart murmur is not a cause for immediate concern. How can doctors differentiate between innocent and abnormal murmurs? So doctors use several methods to determine if a murmur is innocent. Characteristics of the sound. So we know that innocent murmurs often have a specific quality, timing, and duration that trained clinicians are skilled in detecting. Also, physical examination. So they may check for other signs of heart problems like bluish skin, delayed growth, or difficulty feeding. They'll also assess symptoms and family history of heart conditions, and they may run additional tests. So if there's any doubt, an echocardiogram, which is basically a heart ultrasound, may be ordered. Pediatricians and pediatric cardiologists are trained to distinguish between innocent and concerning murmurs, and if there's any uncertainty, they will recommend further evaluation. So what causes innocent heart murmurs, and do they require treatment? Innocent murmurs are caused by normal blood flow through a healthy heart. Common types include something called Still's murmur, which is a vibratory sound most common in kids 3 to 7 years old. There's also pulmonary flow murmur, which is due to blood flow through the pulmonary valve, common in newborns and children. And then there's the venous hum, which is heard in the neck due to blood flow in the jugular veins. Innocent murmurs do not require treatment because they do not indicate any heart problem or dysfunction. They also don't cause any symptoms or health issues, and they often disappear on their own as the child grows. Regular checkups are usually sufficient to monitor innocent murmurs. So when should parents be concerned about a heart murmur? While most murmurs are innocent, parents should be aware of signs that might indicate a more serious condition. So if the murmur is accompanied by other symptoms like shortness of breath, chest pain, or fainting, if the child shows signs of heart failure, such as poor feeding, excessive sweating, or poor growth, if there's a family history of congenital heart disease, and if the doctor expresses concern based on the murmur's characteristics or other examination findings. So in these cases, further evaluation by a pediatric cardiologist, which is a specialist, is usually recommended. Remember, even if a murmur turns out to be related to a heart condition, many of these conditions are treatable. But I know, as a fellow parent, how scary all of this can sound. All right. Well, I hope you learned something today. And remember, we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, please let us know. Leave us a review and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.
If you're listening to this podcast, then we know you love learning. So let me tell you about Airwave History Plus, now available on Apple Podcasts. Airwave History Plus is your ticket to ad-free listening, bonus content, and early episodes from dozens of the most popular history podcasts, including History That Doesn't Suck, The Explorers Podcast, The History of World War II, Queen's Podcast, The History of Egypt, The Age of Napoleon, and more. For your free trial, search Airwave History Plus on Apple Podcasts and hit subscribe. That's Airwave History Plus, available now on Apple Podcasts. Airwave History Plus, the essential audio destination for history lovers.